My name is Emily Slater. I am doing my full assessment for St. Joseph's College, Maine, and this is my preceptor, Kathy Anderson. Bear with us, we're working in a small confined space for the full physical assessment. So I'm going to go ahead and begin.
Sounds good. We're also dealing with, we have another resident in the room, so we're keeping our voices fairly low.
Okay. So I'm going to start with the head. I am just visually going to inspect the skin for color, temperature, turgor, edema. Does she have any swelling, any bruises? I don't see any scars, lesions, or nevi. Then I'm just inspecting the head for symmetry, midline position, and a normal size. She's very normal phallic. Next, I am going to palpate and inspect the scalp for, I'm just looking at her hair distribution. Her hair is of a normal color. She's got nice hair texture. I'm just visually looking for any infestations. Next, I'm just going to use my hands to palpate to see if I feel for any deformities, masses, any depressions in her scalp, which I do not feel. Then I am going to go ahead and feel her temporal arteries for tenderness. So if you tell me if you have any tenderness, okay. Then I'm going to go ahead and palpate her lymph nodes. I'm going to start in back with her occipital lymph nodes. I'm going to just use the pads of my fingers behind in her occipital area. I'm going to move to the post-auricular area, then the pre-auricular. We're going to do consular. You may feel a small lymph node on the left side. That's movable. Submandibular, submental, and then I'm going to do anterior cervical, posterior cervical, and then the supraclavicular. Then I'm going to look at cranial nerve number 5. That includes masseter. I'm going to just get you to clench your jaw, nice strong masseter muscle. And I'm going to do light touch to her face. I'm going to use the end of this Q-tip. I'm going to get you to close your eyes. I'm just going to tell me where you're touching your forehead. Okay?
Nose.
Alright.
Right cheek.
Okay.
Left cheek. Chin.
Good. So next, keep it nearest. I'm going to do cranial nerve 7. I'm just visually inspecting for any symmetry while I get her to do some pretty common facial movements. You get to smile and frown, pucker your lips, now blow out your cheeks, and nice strong, and just raise your eyebrows for me. Good, and all the movements are symmetrical. Next, I'm going to go ahead and move to the ear. I'm just going to visually inspect the ear for size and position. Just medium-sized ears. They look like they're in the correct position here. I am then going to take my otoscope. I'm going to look inside her ear canal. I'm going to pull the pinea back while I do it, and membranes in the ear are a nice light pink color. She's got a good cone of light on her membrane. I don't see any cerumen. I'm going to maybe just look in this side. Again, nice light pink color. Good cone of light. I don't see any cerumen there. Next, I'm just going to palpate the pinea and the tragus of the ear. Again, the pinea and the tragus of the ear for tenderness or any masses, which she has none. Next, I'm going to do cranial nerve number 8. That's going to include a whisper test, a Weber test, and a Wren test. The whisper test, I'm just going to hold one hand over one ear and whisper a number in your ear, if you could just tell me what it is.
21.
And I'm going to do the same thing on the opposite side. good. And then I'm going to use the tuning fork. I'm going to make it vibrate. I'm going to place it in the middle of your scalp. And if you could just tell me if you feel it more in one ear or equally in the middle.
I hear it.
Okay. And then I'm going to do the REM test, which I'm assessing for, I want air conduction greater than burn conduction. I'm going to make this vibrate. I'm going to place it behind your ear. And then when it stops vibrating, tell me. And I'm going to place it beside your ear and just tell me if you can hear it.
No. I can hear it.
Stop.
And it's done.
And I'm going to do the other ear as well.
No.
Okay.
I can hear it. It's done.
Okay. So next I am going to move on to the nose. I'm just looking at the nose to make sure it's symmetrical and midline, which it is, and it's straight. Then I'm going to go ahead and just look at nasal patency. So again, I'm going to have to get you to spin your head back. I'm going to look inside her nose. It's a nice pink color. I can see the turbinates. I don't see any exudates in your nose. And again, nice light pink, a little bit redder in the back, but clear. Septum is midline. Then I'm going to go ahead and palpate your frontal and maxillary sinuses. I'm going to push up right here. Just tell me if you feel any tenderness. And then right here. Feel any tenderness? Okay. So then I'm going to go ahead and move on to the throat and the mouth. I'm just visually inspecting the mouth. I am going to just give me a smile and looking at her teeth. I'm going to use this tongue blade. I'm just going to kind of lift up your lips here a little bit. I'm looking at her gums. They're nice and pink. I don't see any lesions or anything. Get you to open. And I'm looking at the inside of the mouth. Nice and pink. I can see the palate, salivary glands. I'm looking at the mucosa under the tongue. If you stick your tongue out for me. I'm looking at, I can see tonsils. Okay, tonsils about a grade 1. Next, I'm just going to go ahead and do cranial nerve 9 and 10. If you could stick your tongue out for me and say ah. I'm looking for symmetrical rise in the soft palate and uvula. And then I'm going to just get you to stick out your tongue. I'm doing cranial nerve 12. I can see symmetrical tongue without any fasciculations. Okay. And then I am going to go ahead and palpate the tritium J. I'm going to find just a little depression right on right in front of her ear. If you could just open and close your jaw for me. And I'm feeling for subluxation and crepitus, which there was a tiny bit, but any tenderness there. Okay. And next, I am going to do her eyes. I am just visually inspecting the brow, the eyelashes. She's got nice long eyelashes. The palpebral fissures, making sure they're angled in the right direction. I don't see anything in the palpebral fissures. Then I'm visually inspecting the sclera and the conjunctiva. Her sclera looks nice and white. I'm going to take my thumbs and place them on your cheeks. I'm just going to pull down. I'm looking for the color inside the conjunctiva, any lesions or discharge. It's nice and pink with a little bit more red around the rim. Then I can do cranial nerve 2, which is gross visual acuity and peripheral and central vision. I'm going to go ahead and just get your bed to raise up a little bit more. Okay. You want to sit up. And I want her visual fields to be pretty symmetrical. Right at the same size as mine. So for gross visual acuity, I'm first just going to ask you, do you see anything that's blurred or skewed on my face? All right. I'm going to hold up just some digits if you just tell me how many fingers I'm holding up. 6. Okay. Now I'm going to use the pocket Snellen chart that I have. I'm going to hold it about 14 inches away from our eye. I'm going to get you to just read, choose a line and read which one you can read the best.
4, 2, 6, 7, 3, 9.
Which line is that?
Oh, yeah.
Oh, okay, wow. All right, so 20/20 vision. And then I'm going to do her peripheral and central vision. I'm just going to divide our visual fields up into 4 quadrants. I'm going to get you to focus on my nose, and I'll hold some fingers up. Just tell me how many I'm holding up. 2, 1, 2, 1. Okay. And then I'm going to go ahead and do our peripheral vision. I'm just going to get you to cover one of your eyes for me. And then tell me, just focus on my face, my nose, and tell me when my fingers come in your visual field. No. Okay. I'm going to go ahead and do them from the bottom too. So just tell me when they come into our visual field. No. Okay. And I'll get you to cover the other one. Tell me when my fingers come in your visual field. No. Alright. And we'll do it from the bottom. No. Okay, perfect. Alright, so now we're going to do cranial nerve number 3. I am going to look for direct and consensual pupillary reflex. For direct reflex, I'm going to shine the light in your eye. I'm going to look for it to constrict. For consensual, I'm going to shine the light in that same eye, but look for the opposite pupil to constrict. So the pupils go from about 4 to a 2, and then I'm going to look at this side and make sure her same thing, quick pupillary reaction to light. And then I'm going to look at this one. Okay. So next I'm going to do cranial nerve 3 again for accommodation and convergence. I'm going to get you to just focus on the end of my pen. I'm going to move it in towards your nose and back out towards me. Okay. And then I'm going to bring it back out. Okay. Now, I'm going to keep having you focus on the end of my pen. I'm going to test cranial nerves 3, 4, and 6. And I'm looking for any conjugate gaze, and I'm testing her extraocular movements. Perfect. Alright. So next I'm going to go ahead and do your neck. I'm just looking for any visually inspecting for color, temperature. She's got good turgor, nice smooth texture. I don't see any swelling. I don't see any scars or lesions or bruises. There's a small non-suspicious nevi on the side of the neck. Then I am going to go ahead and palpate to make sure that your trachea is midline. I expect it to be right central between the sternocleidomastoid, which it is. And since we're in this position, I'm going to go ahead and palpate her thyroid gland from the front. So I am going to get you to swallow, and I feel that nice cricoid cartilage right here. I'm going to just use the pads of my fingers to feel up around it for nice, soft thyroid. Get swallow one more time for me. It's hard to okay. And then I am going to go ahead and palpate the carotid arteries. So I'm going to do each side individually. She's got a nice, strong +2 carotid artery pulsation. I'm going to go ahead and listen for any bruise. any rose. And then I'm going to go ahead and do range of motion of your neck. So we're going to do flexion. We'll get you to just touch your chin to your chest head and bring your head back. So extension and hyperextension there, and some lateral flexion. So here to the side and to the other side. And if you could just turn and look at that wall and turn back and look at me on this side. Perfect. So good rotation. Then I'm going to touch cranial nerve 11, and I'm going to go ahead and get you to shrug your shoulders for me. And then I'm going to get her to shrug her shoulders against resistance. She's got nice strong muscles there. Alright, so next we're going to move to the posterior chest. So I will have you turn that way for me. And here. So posterior chest, I am just visually inspecting for color, just any color changes, or again, any the temperature, do I see any moisture or swelling? I don't see any lesions, no nevi. She doesn't have any scars or any bruises on her back. While she was sitting up, I could visually inspect. I didn't see any nasal flaring. She was in a very comfortable position. She's not tachypnic. I don't see any sternal retractions or any accessory muscle use. So she's breathing quite well. I am going to go ahead and I'm visually inspecting for symmetry. So she's moving, and any obvious deformities. She's moving up and down symmetrical, and I use my hands and just palpate and get you to take a big breath for me. And my hands rise and fall really well together. Sorry, just change the camera so she can kind of see what I'm doing. Maybe. And so next after that, I am going to go ahead and palpate for tactile primitive. So I'm going to get you to say 99 as I move my hands down. 99. Okay. 99. 99. Okay. So I was looking for any increased vibration, which she does not have. Next, I'm going to go ahead and try to percuss the lung fields in between the intercostal spaces, and it's going to move your sports bra a little bit to the left. Go ahead and do the other side. Making sure I don't hear any nullness or consolidation. She's got really nice sounds. Okay, next I'm going to go ahead and auscultate her lungs. I'm going to start up here above the scapula. I'm going to move down to the bases, and then I'm going to try to move to her right lateral lung fields to assess her right middle lobe. So every time I move my sticks, I'm just going to get you to take a deep breath. Good.
I use this.
Clear lungs. Now I'm going to just auscultate over here in the right lung. Nice and clear there. So next I'm going to go ahead and look for, I'm going to auscultate for egopny. I'm going to get her to say E, and I am hoping that it still sounds like E. If I hear ah, that can be an indicator of consolidation. So I'm going to just get you to say E each time and move my stethoscope.
E, 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 E,
Next I'm going to do bronchoscopy. Again, looking for consolidation. I'm going to ask her to say 99 every time I move my stethoscope. I'm hoping that it stays the same volume.
99.
So good. And then next I'm going to do whisper pectorally. I'm going to get her to whisper 99, and I should not be able to hear it, but there will be increased volume if there's consolidation present. So go ahead and whisper 99. So next I'm going to go ahead and do the anterior lungs, or the anterior chest. So I am just, again, visually going to inspect for any color changes, any texture changes, temperature. Is she moist? Any scars, lesions, bruising, or nevi, which she does not have any of. I am just visually inspecting for symmetrical chest rise. She has nice symmetrical chest rise. I do not see any chest deformities, and I'm going to go ahead and palpate for symmetrical chest movement. So I'm going to put my hands over just here and get you to take a deep breath. She's got nice symmetrical chest rise. I'm going to use the inside tabs of my hands again to check for tectum fermentis. So I'm just get you to say 99. 99. Okay, perfect. And then I am going to go ahead and just auscultate your anterior lung field.
One thing, if we could lower this down, we could clean that up, or like, make sure it didn't spill anything. Oh, it's running.
Just make sure your light off.
Oh,
And we do it. Just
No.
do it right here, lateral one.
well, it's fine.
Okay.
Sorry.
So I'm going to move on to the heart, and first I am going to just go ahead and auscultate all 5 areas. So with the I'm going to start with the diaphragm. I have an electronic stethoscope, and then I will switch to the valve. So I'm going to go aorta,
Yeah.
pulmonic, third point, tricuspid, and then we're going to do mitral. Okay. And then I'm going to switch to the valve. And I'm going to again do aorta,
Okay.
pulmonic,
Not yet,
third
no.
point,
We got,
tricuspid, and then mitral. So my next step would be to look, identify, and find the point of maximal intensity. Typically, that's right around the mitral area. Okay, good. Right here. And hers is right in a nice spot, confined about a centimeter in size, and it looks like it's maybe mid-clavicular line. I'm going to go ahead and auscultate her heart for 1 minute. Right there. Got a nice regular rhythm. And again, a regular rhythm. Now I'm going to actually have you lie flat in the bed. And just lay the bed out. And I am visually going to inspect for any heaves or lifts over her chest area. I don't see any abnormal pulsations or anything, heaves or lifts over those auscultation spots. Next, I'm going to go ahead and palpate each auscultation spot for thrills, over the aorta, pulmonic, Erb's point, tricuspid, or we'll do the mitral area. Now, those would indicate any turbulent flow. So next I'm going to go ahead and just auscultate again while she's lying down flat, again with the bell and the diaphragm on my stethoscope. So I'm going to do the diaphragm, the aorta, pulmonic, Erb's point, tricuspid, and then we'll do the mitral again. Right, and then I'm going to do switch to bell.
Yeah.
And I'm going to do aorta. Pulmonic. Point. Tricuspid.
Good morning, Mr. McCaffrey.
Good morning, Dr. Ashton.
And
Dr. Ashton?
mitral.
No, I'm Doc. I'm a occupational therapist.
Oh, okay. I'm just wondering, I wanted to ask you a few things because of the traumatized to take care of.
If it's medication related,
Sorry. And then I am going to go
Thank you,
ahead
ma'am.
and raise that up 30 to 45 degrees. And I'm going to assess for jugular venous dissension.
For the training
I'm just going to look on the side of her neck just to find where I can see the point where there's a highest pulsation. It's probably about right here. I'm going to go ahead and just use this pen light as a measurement tool, go across and measure it from the sternoclavicular notch. I have a ruler right here on the side, and it's about a centimeter from the sternoclavicular notch. Next, I'm going to go ahead and do an assessment of the abdomen. I, again, first am going to just visually inspect her abdomen for any color, temperature, moisture, any swelling, which I don't see, any changes in texture, just nice smooth skin. And I am going to, I don't see any scars, bruises, lesions, or any nevi. I am looking at the contours and the symmetry, she's in a nice symmetrical abdomen, nice normal contours. Then I am going to auscultate for any bruise of the abdomen.
It has arrows up and down.
I'm going to start with the aorta,
And this kid gets bit up
the
or
ovaries,
down.
Yeah, okay, I'll get to
the
that.
arteries,
And then, well, the whole bit up and down.
Yeah.
And then you have,
bruise, iliac arteries,
and then you have, for the
and
legs.
then we're going to do femoral arteries.
So lower a little bit. Think of it,
Again, no bruises.
What are you trying to do?
I'm just gonna try to.
So now I'm going to go ahead and auscultate the abdomen for bowel sounds in all four quadrants. So we're going to start in the right upper quadrant.
Let's do that.
Okay.
Then after bowel sounds, left upper quadrant. Left lower quadrant. After bowel sounds, and then right lower quadrant.
Okay.
Good. So then I'm going to go ahead and percuss for temporary dullness and flatness. I expect some flatness up here. The liver is there. So good tympany, the liver must again right here.
Here we go.
And then I'm gonna
Now we can get started.
put it there.
Good.
Good. So the next step would be to palpate for any tenderness or deformities. I'm just going to lightly push in her belly in these quadrants and move over here. Tell me if you feel any tenderness.
So once again, I'm Dr. from Occupational Therapy. Do you know anything about occupational therapy?
Well,
so I do not feel any masses or no places of tenderness. So I felt her liver right back here, over there. I'm going to just put my hand behind her back and get you to take a deep breath. I'm going to try to palpate the edge of the liver, but it must be right at this ostal margin here. So I'm going to go ahead and do the same thing with the spleen that I expect to be over here.
In my house,
Okay.
which caused me to break.
And then I want you to just set up. I'm going to do,
So I had to go.
look at your back, and we're going to do costovertebral angle
So I
tenderness.
needed roughly with.
I'll put my hand over her back. I'm just going to tell me if you feel any tenderness when I do this. Okay. So next we're going to go ahead and do
Remember,
the
he was away. She's
upper
forgetful.
extremities.
And she has,
I guess I'll just get to the
rid of all.
Alright, so what I'm going to start with is just visually inspecting the hands for symmetry, any redness. I don't see any swelling, any deformities, and then I'm just going to palpate each finger individually for
Teach
any nodules
their pupils, teach their students
or any tenderness. Just as we go along, tell me if there's any tenderness.
as normally as possible.
So I don't see any of those things. I am just going to go ahead and test for capillary
Or
refill
whatever that's.
in each finger,
Yeah.
which
That
is
gives
less
you-
than
gives you
3
general idea.
seconds.
So the first thing that we
She's got
need
very
to
good
do
capillary
is
refill.
kind of get you back to your normal.
And I'm going to just go ahead and palpate your radial pulses bilaterally so I can have a comparison. Both of them are good, plus 2 strong regular pulses.
Now tell me, where do
Then
you
I'm
live?
just visually inspecting inspecting her arms for good color, edema,
in the western part of,
warmth. She's got good skin integrity, again, good color, no edema. She's normal warmth and good skin integrity.
Okay.
Then I am going to get you to do range of motion in your hand, in your fingers. So just follow my lead. We're going to do flexion, extension. Are you able to bend back anymore? Okay, so hyperextension. And then we'll just spread your fingers apart. Abduction, adduction. I'm going to get you to hold your hands up, and if you can do some thumb opposition. Okay. Alright. So next I'm going to do hand grips. So I'm just going to get you to squeeze my finger. Good. And I'm going to get you and then squeeze my, great. So she's got good 5 out of 5 strength. Next I'm going to just start looking at her wrist. Visually inspecting, are they symmetrical? Do I see any redness? Any visual deformities? I'm going to just palpate in here. And I don't feel any nodules. I don't feel any crepitus. No nodules, no crepitus. To get you to do some range of motion in your wrist. Get you to point down towards the floor, so flexion. Get you to point towards the ceiling, extension, and then I don't know if you can bend back anymore, hyperextension. And I'm going to get you to hold your hands right here. We're going to do radial deviation, so if you could just bring them inward, and then outward ulnar deviation, and I'm just going to get you to rotate your wrist. Perfect. Okay, so next I'm going to move up to the elbows. And at the elbows, I'm just feeling the medial epicondyle here, lateral epicondyle, and the olecranon.
Good morning.
Olecranon process. And then I am going to look again on this side for the medial, lateral, and olecranon process. I'm looking for any redness, edema, any visual deformities. They're symmetrical.
How long ago did you
Any nodules, I don't feel any nodules that I'm palpating or tenderness. I'm going to go ahead and just get you to flex for me and extend. And I'm going to get you to flex against resistance, okay? And as you flex, could you push against my hand? Good. Push against my hand. So she's got good 5 out of 5 straight there. I'm going to move up into the shoulder girdle. I'm going to start at the sternoclavicular notch, and I'm just going to palpate my way out here to the acromioclavicular notch. We're going to feel the greater tubercle here, and just feeling for any areas of tenderness. I don't feel any nodules or anything here. I don't see any redness or deformity. I'm going to go ahead and just palpate.
How about cleaning the hole? Did you clean the hole?
Feel the head of the humerus over here. And again, no nodules, no tenderness, no deformities. I'm going to just do some range of motion with you. If you could just flex for me. And then I'm going to get you to bend your arms behind you. So like extension, and then back hyper extension as far as you can go. Great. Okay. So, could you try to brush your hair? So that's good external rotation, and with the other one. And then we're going to do internal rotation, just like that. She's got good internal rotation. And we can do circumduction if you could just.
Yes.
Good.
Even the day before.
Alright, and so she's got
fracture.
we're going to abduct.
Okay.
Abduct. And so I'm going to get you to abduct against
anything around the garden?
Abduct. Good.
And then
I'm going to get you to abduct. Good.
And we did hire
Alright. So now I'm just going to do light touch in her upper extremities.
we recently,
I'm going to have you close your eyes for me
because they weren't
and
taking
just tell me
it.
where I am touching you.
very first surgery, it turns out that we have resident relatives who were also in that business.
Okay,
And
perfect.
a couple
So
of
she's
them,
got
one
good
day
like
went
touch in
down
her
and
upper
saw
extremities.
people
Then
to whom we
I
were
am
paying
going
huge
to
amounts of money were doing, and it was pretty outrageous the way they were.
diagnosis. So I'm
And
gonna
so,
just get you to close your eyes again. I'm gonna hand you a pretty common
Nobody paid
object.
off what we owed them,
You
and then
just tell me what I hand you.
Bottle.
Okay, perfect. And keep your eyes closed for me. I
So
have to do
how did the
anesthesia.
fall
I'm gonna
happen?
write a number on your hand if you could just tell me what it is.
with me, I was
4.
walking
Okay, good.
around. There was
Alright, then I'm gonna write a number on the other hand, and if you could tell me what that is. Okay, perfect. And then I'm going to go ahead and do vibratory sense over the proximal ulnar prominence. So I'm going to use my tuning fork. I'm going to place it over the proximal ulnar prominence. And then I get you to tell me if you can feel it vibrating down.
Let me finish, yeah.
Perfect. We're going to do the other side.
One second, Metro, and then we'll get
Tell
back
me
to
if
the
you can
story.
feel it vibrating.
Okay.
I'll be right back. I'm not leaving the room.
So next we're going to do cerebellar coordination exercises. With cerebellar coordination, if you just follow my lead, I'm going to get you to do this and go backwards. And that's called zero finger opposition. Now we're going to do hand flip flop.
If you will,
I
please
can
over
just
it back.
get you to use this hand and flip flop it back
Get it down better that
on
way.
top of your leg. Okay, perfect. And we get you to do the other hand. And then both hands at the same time. Perfect. Okay, I'm gonna get you to touch my finger with, and then touch my finger, so finger to finger. Alright, so next we're gonna do deep tendon reflexes. I'm going to, if you wanna come over here.
Got it?
So I'm gonna start with the brachioradialis. I'm gonna just get you to relax your arms. We're gonna feel this tendon right here. And I'm going to, and then I'm gonna do on the opposite arm. Perfect. And we're gonna do the biceps tendon. I feel it right here. I'm gonna keep my thumb over this. And she's got
You want me to put
good,
some
good
applesauce? It
reflexes.
helps.
We're gonna do
Okay.
triceps. And I'm gonna find it right behind here.
Yeah.
Hit my thumb. The triceps contract. I'm going to do it right back here. My thumb. Perfect. And then I'm going to move to the patella. You can see that. Alright, so I'm going to feel where this indention is here, and I'm going to go ahead and try to feel out the things.
That helped, right?
Good, quick reflexes.
Yeah, now we know the drill.
We're going to do
Alright.
Achilles.
Thank you.
I'm just gonna hit the back of her Achilles. I'm hoping that her feet will point towards the floor.
Look back there.
Again,
It
back
looks like an even form back
Achilles.
there.
And then I'm gonna do Babinski.
Twists and turns
And
that has happened, just happened.
I'm gonna look to see which way her feet point.
No, I'm actually
And then,
doing some of the
so,
students, my students.
Oh, yeah.
and then next
Right.
I'm just gonna stay down here and I'm going to inspect her feet. I'm again looking for any redness, edema, swelling, any deformities, visual deformities or asymmetry that she does not have. I'm just going to palpate the toes, see if there's any tenderness there, and the metatarsals here. Good. And then we can do, if you can
Okay.
flex your toes,
So,
so twirl them under, and then bring them back up. Can you
Right now, do you
spread
have
them apart?
anything?
Perfect. So abduction,
No.
then just pull them back
No,
together.
I
It's
don't think,
adduction.
no.
Alright,
If
so
you- if you
next
move,
while I'm down here, I'm going to go ahead
you
and just
feel
look
the
for
pain there.
capillary refill.
I mean, I can read
She's
my,
got good, quick
injured
capillary
leg.
refill.
That's a
And
strain,
her
but it's
toes.
not,
I'm going to palpate for
sharp pain or anything
dorsalis
like that.
pedis pulse. Good.
Anything I move,
Plus
it's
2
fine,
pulse in her foot.
Okay. Now, what did the doctor say about that
Plus 2
leg?
pulse.
Is there some
Then I'm going to do
restrictions?
post-tibial.
Well, actually, we haven't I haven't really had a conference with the doctor yet about it.
Mm-hmm.
And then
Oh, when you
Let's
were
see,
in
it was,
hospital.
this season, he performed, the only actual
good
doctor I
plus 2 post-tibial pulse.
interacted
Alright, so
with
also,
is
I'm
the
just gonna
surgeon.
generally
And I didn't
inspect the
talk to
legs
him
for
about
any
it.
color, skin integrity,
Did-
temperature,
tell you about
good
how
normal
much weight you're
temperature,
supposed to
feet
put through
are
that
nice
leg?
and warm.
Well,
I don't
first
see
of
any
all, when I
edema
was
here
in the
at all.
hospital, the
I
result of the surgery was
am
performed
going
right
to
away.
go ahead and move up and just
then
look
I
at her
was in
knees.
the
I'm inspecting her knees again for
intensive
any
care
redness,
unit, I guess.
symmetry.
And I was
I do
told-
not see any swelling.
Sometimes
I'm
I
just
try
going
to
to
come in
palpate
the bed,
here
you know, and go to the
for
bathroom
any
on my own.
abnormal nodules.
toilet on
I'm
my
going to
own.
flex and extend for me.
And
Don't
they would
feel any
always tell me,
crepitus.
"Oh, no,
Again, flex
you
and
get
extend
back
for
on
me.
that
Don't
bed,
feel any
you don't any
crepitus.
weight on that left leg at all."
Obviously,
No
we
weight
just
on
did
the
some
left leg.
flexion and
Okay.
extension.
Then I would go
Again,
in
flexion and extension.
look
I'm gonna get
over
her to
another way,
flex
and they
against
go,
some
"No weight on that
resistance.
left
Go
leg."
ahead and bend your leg out good. And I'm gonna get you to extend your leg back against some resistance. Great. And I'm gonna get you to flex again against resistance and back against
Okay,
resistance.
okay.
So she's
And
got
that's what
really
I was
good
referring
strength
to, because
in her
a lot of things that we
knees.
have to do through the day,
Okay. So
They will,
next, I'm just gonna have
you
you
know,
lay
you're
down
often
really
moving
quickly.
in one way or the
and
other, and that
We can
means
do
no weight through that leg.
hip
Yeah.
abduction
right,
and adduction in the bed. So if you could, can you bring this leg out
those,
towards me?
sticks,
Good. So good abduction and
walking poles
adduction, and then
Yeah,
bring
but
that
still,
leg
still
out.
for right now,
back,
no
so
weight
good
means
abduction
even
and
when you're in
adduction.
bed.
So
not
now we're
putting
gonna go
your
ahead
weight
and do
in,
that
shift
against some
Yeah.
resistance.
It's
So
hard
push
to
your
do.
leg
It's
outward.
hard to do.
Right,
Against
it
It
is.
means
Good.
that you
And
broke
then
that
inward.
leg quite a bit.
Perfect.
Yeah, well, I've
So,
seen
and then
pictures of
we're
it.
gonna do
I've heard-
outward.
Now, there are some
and
doctors who have come in, I mean, you know,
Great.
the assistants
So,
who come in, and they're
She's got
very,
good 5 out of 5 strength in her.
almost
um,
sarcastic about it.
in her
You
hips.
really did a
So
job
next
on
I'm
that.
going to go
Thank
ahead and
you.
do light touch in the
One second,
lower
let's
extremities.
take that oxygen
I'm gonna
there.
get you to close your eyes and just tell me where I am touching you. Right foot, okay? Right knee. Left foot, okay? Left knee. Alright, so she has good light touch. Then you can open your eyes and I am going to do vibratory sense over the medial malleolus. I'm going to place the vibrating tuning fork over there and just tell me if you feel it vibrating and when it stops.
Oh, okay.
Alrighty,
And then we're going to do the opposite leg,
let's try.
okay? And
Let's try
Then
see how well we can sit
I
on the edge of the.
actually going to have
I'll
you
help
stand
you
up.
with this.
I've tried to do that when,
Got your
you know,
socks
but,
on.
I tried to do that, and, what's it do for you? I did it fast.
Okay. Good, that's fine.
You know, when I'd be urinating.
Alright.
Well, also in that came too, for a bowel movement too. Now, the idea was that, to see if I could do that.
We're gonna go right here, in this corner.
That kind of
I'll have
thing.
you come towards me. We're gonna
they,
just go ahead and I'm gonna just
What I would do
visually
eventually is say,
inspect
no, I better get
her
somebody
hip.
with- somebody to help me out.
So we got the curtains pulled. I'm just looking here. I start right here where there's a dimple
Alright, try to
and
move your legs to
her
sit on the
iliac
edge of it.
crest, and I'm just
Alright.
looking again for any redness,
Oh,
swelling,
man.
any. I'm gonna palpate forward
Mhm.
for any nodules. Is there any tenderness in that area? Okay,
Takes some
and
doing, I tell you.
can you just bend your knee up for me? Okay, I don't really feel any pressure. I'll get you to turn the other direction.
You'd rather
And I'm gonna just inspect this one as well. Again, I'm gonna start where this dimple is and
lean
pull
forward.
that crest.
Pardon?
Lean
And I'm
forward.
just feeling over. Do you feel any tenderness? I don't see any redness. Bend your knee up. I'm gonna just feel for practice best.
Lower the thing right up down, right over here.
Yes.
And any edema, her hips are symmetrical, so that's perfect. So now we're gonna do some more range of motion of the hips. So I'm gonna have you just turn facing towards the camera, and I'm gonna just get you. We're gonna do flexion if you would bend your knee up,
I don't know.
and then
A
bend
lot
that
more
knee
than
up.
usual.
It's
You
a,
can hold on to the bed if you need
I'm
to.
taking yoga for a
Bring your
few
knee
years
back
now.
behind you. Good. So extend extension,
there.
and then
Okay.
try to extend the other knee back.
Are you
Good.
feeling dizzy or
If
anything?
you want, let's try hyperextension and go back as far as you can. Perfect. Alright, go back as far as
Just
you
a
can.
little bit,
Okay,
not
good.
too enough.
So, I'm gonna get you to turn your feet in towards each other, so we're doing internal rotation.
Oh,
And then we're gonna do turn your feet out towards,
they haven't
so external rotation.
helped
And
you.
then I'm gonna have you kind of swirl one of your feet around. So we got circumduction, and we can do the other one.
Yeah, it's too big.
Alright, so she's got good range of motion in her hips. We can check
Not so
again
much
range
it's
of
big,
motion
but it's
of
meant
the
to be
knee.
big,
If
but
you
it's,
just bend at the knee
not
again,
enough of my
we've seen that.
Schwarzenegger,
Bend at the
enough
knee
of
again.
muscle.
It's a good flexion and extension of the knee. Alright, so now that she's standing, I'm gonna go ahead and get you to turn around. I'm gonna just inspect your spine. So visually, I'm just looking for contours,
Take it over completely and then
and contours, symmetry. Okay. I'm just gonna palpate down. I'm looking for the curvatures of her spine, so curves out in the thoracic and cervical area. I don't feel any nodules. It's curving back in the lumbar area and down to the sacrum. So next I'm going to do just some range of motion of the back. I am going to go ahead and just get you to bend over. So this is flexion. I'm going to get you to stay flexed. I'm looking for any the good alignment of the spine. So scoliosis. Doing a scoliosis.
I'm trying to figure out because I don't know nobody right here and I'm back and forth for the train.
I'm going to go ahead and feel up the spine again. It's nice and straight. I'm going to get you to stand up. Alright, so I'm going to get you to extend backward for me. Alright, good. And then how far can you extend backward? We're looking for hyperextension, perfect. And then if you could bend towards the side, so lateral flexion, and again. And then just keep your hips centered, but try to rotate your torso.
Here you go, Papa.
Okay, perfect.
Good.
Alright, so the next test that I'm going to do is I'm going to have you turn around towards the camera,
Alright, this one.
and I'm going to
Do you feel like
get
you lost a lot of weight
to
since
do
you've
a
been in the
Romberg
hospital?
test. I'm going to have you close your eyes,
I mean, not a lot of
and
weight.
your feet are together, her arms are by her side. I'm visually inspecting for any swaying.
Let's put it this way. I was
She has
losing
minimal
strength
swaying.
when I came in.
Should do this
Because
about
I had been
30 seconds,
lax
but
about
still
the
minimal
regular
swaying.
exercise.
She's
I always
standing
do
pretty
regular
still.
exercise,
So I'm going to go
but
ahead and
then
get
I
you to
got
open your
involved in
eyes.
some,
Remember, we
a lot
have
of
very
paperwork
limited
and
space in here, so
taking
I
care of
am
home
going
breakfast
to
and all this other
just
stuff, and,
get her to
sometimes
walk
you
here
know,
across, and I'm doing gait in tandem. I'm just going to get you to normally, as you would walk down the street, just walk across here.
lose the weight
Okay,
and you get
and then if you could go back towards the heater on the wall. Okay, perfect. So next I'm going to get you to do, if you could put your heel to the front of your toes,
try to hold me.
and we're checking tandem, and if you could just walk across for me,
Tight.
there,
This side.
perfect. She's got good coordination, and she's doing this very steady.
Straight.
Okay, perfect. So the next thing that we will do is I'm just going to get you to hop on one foot and then hop on the other.
Are you
And,
here? Okay, put both
I'm
hands in
going
your
to
lap
thank
first.
Candace for coming in to do the assessment with me,
Sit stable.
and we are,
Stable, yeah, of course.
Reach for my
okay,
hand.
thank you so much.
With both hands or
No,
with
one